to correct me. Gleechin, it's so nice to meet you. Thank you. Hi, everybody. All right, I'm going to get ready to kick off today. So thank you so much for joining us. For those familiar faces in our audience today, hello. And for those new faces, welcome. My name is Kendall Lee. I am the program administrator of the Maryland Emergency Preparedness Network. And the EPN is an emergency preparedness communications network operated by the Maryland National Capital Home Care Association, otherwise referred to as MNCA, in partnership with the Maryland Office of Preparedness and Response within our state health department. And we provide emergency preparedness education, training, and resources to home and community-based healthcare providers, patients, and their caregivers. I would like to extend my gratitude to Executive Director Caitlin Hauk of MNCA, who's joining us on the call today, as well as the staff at the Office of Preparedness and Response in our State Health Department for their ongoing support. Your invaluable partnership makes this work possible, so thank you for being with us today. I am so excited to introduce our guest and to begin today's presentation, but before I do, let's cover just a few housekeeping tips. So today for the recording, today's webinar will be recorded and you can expect to receive the link to the recording following the event. Additionally, this recording will be made publicly available on both our website and our YouTube channel. As for the audio and camera portion of today, you have complete control over your microphone and camera settings. While we kindly request that you remain muted during the speaker's presentation, we welcome you to come unmute during the Q&A portion of today's event. And additionally, attendees are warmly invited to activate their cameras, as some of you already have. It's lovely to see you, to connect with us today, though it is not required. As for the Q&A, we encourage questions. Today's presentation's contents will not extend to the full hour, though we've allotted the full hour so that we have time for questions. So we welcome you to submit them in the chat box, which will be monitored, and we will gladly address your questions at the end of today's presentation. Finally, I am thrilled to introduce our guest speaker and introduce our topic. So today we have with us Diane Kashak from the Maryland Department of Health's Project Firstline. Project Firstline is an innovative outreach program developed in partnership with the Center of Disease Control and Prevention, and it's designed to promote foundational knowledge on infection prevention and control for all types of frontline healthcare workers across Maryland. Today's presentation specifically will introduce you to a micro-learn or micro-learns, which are a series of brief, guided infection control discussions that are offered by Project Firstline. By the end of today's presentation, you will be able to understand how to use these guided discussions with your team through an applied example. The topic for today's micro-learns discussion is cough and congestion. And as we know, respiratory season is upon us, and its accompanying colder weather keeps us indoors. And we know that the more time spent indoors, that increases our risk for illness. We thought, what better of a topic for this time than cough and congestion? So this guided discussion will review infection control measures to use when caring for patients with cough and congestion. So Diane, I am going to hand it off to you to guide us through.
Okay, well, thank you very much. That was a great introduction. It might be a little redundant. I might have a couple things very similar to what you said. So good afternoon, everyone, and thank you for joining us today for our MicroLearn session. My name is Diane Kashak, and I will be facilitating this webinar. Thank you to Kendall and the EPN Network for hosting this Maryland Project Firstline MicroLearn session and for running the PowerPoint. I would like to ask everyone to stay muted throughout the presentation, but if you do have any questions or comments, feel free to place them in the chat. And at the end of the session, you are welcome to come off mute if you would like to ask a question live. This information, as Kendall suggested, is presented to you by the Maryland Project Firstline, which is a CDC initiative provided to our Maryland Department of Health, who has contracted with the company I work for, Health Quality Innovators. This project is designed to offer free infection control training to all healthcare workers and environmental services staff working in healthcare settings throughout the state of Maryland. Our topic is cough and congestion. I will first be explaining what a microlearn is and how to use it, and then reviewing the basic principles regarding this topic. Let's begin. So
Yes,
if you could pull
there
up
it is.
our PowerPoint, Kendall.
Here we go. If you can give me a thumbs up when you can see things, and we are ready to go. Okay.
Okay.
Would you like me to go back here?
Yep, go back. Yep,
Mhm.
you can stay on that slide. So, our agenda for this microlearn is to discover what a microlearn is and how to use it, and I'll be discussing that shortly. Viruses that cause cough and congestion can infect multiple people and cause major harm for vulnerable patients. What to do when you are near a patient with cough and congestion will be discussed throughout this presentation. Our first key point is to discuss what is a microlearn. The CDC put together a series of guided infection control discussions that provide brief on the job educational opportunities. These microlearns are intended to focus on an individual or single infection control topic and connects infection control concepts to immediate practical value. Healthcare workers can easily apply these key points to their daily work and perform the recommended actions to keep germs from spreading. Here are some suggestions for using a microlearn. Before presenting a microlearn, it is recommended the oh, if you can go back one slide. The microlearns reinforce infection control concepts when risks are observed in patients or in the patient environment, but not necessarily with visitors or other staff members. Remind team members that if they see a patient in distress, for example, with shortness of breath, some type of bleeding, or otherwise at risk for immediate harm, they should respond to the emergency according to their facility protocols. Now I will introduce the topic and discuss how to present to your team a microlearn. Step 1. Introduce the topic by starting with the basic information. Let's go through the steps regarding cough and congestion. Coughing by itself can be caused by many things, but a cough in combination with congestion, such as a stuffy nose, runny eyes, and a nasal voice, is commonly called a virus. These viruses spread easily when the infected person breathes or coughs, which can infect multiple people very quickly. Some viruses, like CVM, don't cause major problems for healthy people. However, they can cause harm to vulnerable patients. Next, step 2, expand on the basics. This is a time to share information about what team members should do. For example, if you are near a patient and don't know the cause of their symptoms, use a face mask or use a NIOSH approved respirator. based on your facility's policies. In addition, the patient should be placed in a separate room away from others as soon as possible. If you are working in home health, you might want to suggest they be placed in a separate room at home until the symptoms stop. The patient should wear a mask to keep their germs from reaching you and others as long as it is safe for them to do so. Check the air vents in the room to make sure they are not blocked so the ventilation system can work properly. Next step, step 3. Now is the time to lead a discussion. Find out how your team feels about the topic by asking these questions. What do you usually do when you see a patient who is coughing and has congestion? Do you worry that you might catch something? When might you call for help or assistance? Also, do you have all the tools and information you need to do your job safely? Ask your team, how can we help each other take the right infection control actions when we see a patient who is coughing and has congestion to keep germs from spreading? After you have discussed these concerns with your team, it is time to move on to the wrap-up phase. Step 4, wrap up and reinforce the topic with your staff. Remind the team of the key takeaways. For this topic, one of the most important concepts is if you are near a patient that has a cough and congestion, wear a mask to help stop the spread of germs. Also, remember to keep the air vents open so the ventilation system can work properly. Finally, always remember to follow the guidelines in your facility when implementing infection control policies to keep your patients and residents safe. I would like to make a more general comment. Many of you in this webinar may work in home health or different environments. You can incorporate these same principles when working with your clients. Wearing a mask if the patient has a cough and congestion, making sure the vents, the air vents in the home or your environment are not covered, and talk with your managers and supervisors to see what infection control procedures are necessary for you to follow when you work in your client's home or in these different environments. Next is our Q&A. Feel free to place your question or comment in the chat. And if there are any questions about cough and congestion or how to run a microlearn, I would be glad to answer them. Well, if there are no questions at this time, we can move on. Uh, so it looks like, what are the symptoms? What symptoms of what? Would you like to come off mute and ask that question?
Vixana, if you're with
Oh,
us today, you're welcome to come off mute.
I meant symptoms to know when someone is being infected. Okay, so I'm not exactly sure what the symptoms are when someone is being infected. Once they are infected, there is, as we mentioned, the runny nose, the cough, the watery eyes. Those are in conjunction, the cough and congestion, and it usually means they're infected with the virus. Does that answer your question? Okay, all right. Again, any other questions, feel free to put them in the chat, or you're also welcome to come off mute. Okay, so on our next slide, we have some helpful resources. So our first helpful resource is the Project Firstline MicroLearn Job Aid. It is a 3-page resource guide that has all the information that is contained in this presentation. Feel free to download it and share it with your team. I will now place it in the chat, and you are welcome to download that, share it with staff members. It's just 3 pages, but it does coincide with all the information in our chat, in our presentation today. Our next resource is the respiratory system. I think back one. Oh, no, maybe not. Okay. Go ahead, forward one. Our respiratory. Okay, this is our respiratory system. So this contains information about germs that can live in the respiratory system and some infection control actions to use to reduce the risk of spreading these viruses in the respiratory system. I am going to add this link to the chat as well, and feel free to take a look at this poster. You can download it, posted in your break rooms or at the nurse's station. It does have some really, really good information. Next is our infection control actions regarding ventilation. This ventilation resource provides important details about how the ventilation system works and how it can reduce the risk of germs spreading. Now, again, this information is very important in healthcare facilities. However, there are some basic topics and information that you can also use in the home health or in different environments. And I will place that in the chat as well. And feel free to download that. Next is the infection control actions to stop the spread of viral respiratory infections. This is a very important flyer. It provides helpful information about infection control actions that will stop the spread of viral respiratory infections like influenza, RSV, and COVID-19. Remember, hand hygiene and cleaning and disinfecting are very important steps to make sure you are preventing the spread of viruses in your facility, communities, and in our homes. Again, I will place that link in the chat and feel free to download that as well. Our last resource is about infection control for respiratory viruses. This last resource describes many infection control measures to prevent and slow the spread of respiratory infections in your facility. It also contains some simple suggestions like use of a well-fitting mask, getting the recommended vaccinations, and hand hygiene, just to name a few. Again, I will place the link to that in the chat, and hopefully that will be helpful for you to share with the staff you work with. Our next helpful resource is our website, mdfirstline.org. Please check out our website at mdfirstline.org. We have many resources available on this site. And I also wanted to let you know all the resources we just discussed, they are on our website. So you are welcome to check that out on our website. There's information about our online learning site and how to take our free courses. In addition, we have a quick start bundle that has infection control practices you can use in your healthcare environment. New to our website is our scavenger hunt resource tool. It is a fun and interactive approach to learning about infection control practices. Download this resource today and share it with your staff so they can begin the hunt to find the important resources and guidelines for keeping their patients and the environment safe. And I will put that in the chat as well. All right. Next is our online learning system. It contains 17 courses along with our translated content for topics 1 through 5 in Chinese, Russian, Tagalog, and Haitian Creole. All topics 1 through 7 are also translated into Spanish and can be found here on our online learning site. Please check it out. I'm placing the link in the chat to request access to our online site. Once you complete the request form, a link will be sent to you so you can create a login. And I just sent that in the chat. Stay in touch. Sign up for our monthly newsletter where you can learn more about Maryland Project Firstline and the courses we offer, webinars we will be conducting, and our in-person training opportunities. You can email us at mdfirstline@hqi if you need further information, but I will put our sign up in the chat as well if you would like to receive our newsletter. And I know many of you that are already on our email distribution list do receive it. So if you are receiving it now, there's probably no need to sign up for it. But if you're not, please do so. Please join us for our next webinar, which will be Draining Wound Microlearns that will be offered on Tuesday, December 17th at 12 o'clock. The registration link will be sent out to all learners on our email distribution list. You can connect with us on social media, Facebook and X. And as mentioned, feel free to email us at any time at mdfirstline@hqi.solutions if you do have any questions or need any information about the resources we have available. Finally, I would like to ask everyone to complete a feedback form for today's topic. I'm placing the link to the feedback form in the chat. And if you can please complete that, it will take you just a minute or two. There's only a few questions. Also, you will be entered into a random drawing for a chance to win a $25 Walmart e-gift card for completing our webinar today, along with the feedback form. This is part of our incentive program. And if you're also interested, we have a $50 incentive if you complete all 17 topics, either through our online learning site or attending webinars or in person, but just completing all 17 and completing a feedback form for each one, you will be eligible for a $50 Walmart e-gift card. The disclaimer is you must be a healthcare worker or environmental services staff in a healthcare setting in Maryland. Maryland Department of Health and local health department employees are ineligible for the incentive. Eligibility will be verified while supplies last. And if you do have any questions concerning the microlearn, the topic we reviewed today, please let me know. I would be glad to answer it. If for some reason I don't know the answer, I will definitely jot it down, research it, and get back to you within the next 48 hours.
Thank you, Diane, for putting all these resources into the chat. I think it's so helpful that they coincide as well with each slide. I'm just
Yes, you're
keeping
welcome.
an eye on the chat, and I do not see any questions at this time, but anyone is welcome to ask, whether that be about this session in particular, about the microlearns, about Project Firstline, and we're more than happy to support you.
Absolutely. And I'd like to thank everyone for attending this webinar. I hope it was helpful to you as you continue to care for your patients, residents, and clients in their healthcare setting, whether that is in a healthcare setting or in their homes. And thank you for your service and for your dedication to those in need.
Patty just made a comment. She said,
Oh,
"Thank you, very informative. I printed the forms and will use them with my staff."
great,
And
great.
IP, so infection
And prevent,
prevention,
right. And
preventive
it's
in an SNF.
It's
Thank
skilled
you so
nursing.
much, Patty.
Yes. Thank you so much, Patty. And
Great
please,
name.
if you do try the scavenger hunt, we would love to hear how it turned out with your staff. It's very new. We just posted it to our website in the last couple weeks. So we're hoping that people will try that out.
Yes. Is the scavenger hunt something that's done in person, or is this offered virtually as well?
The scavenger hunt, actually, it's not done in person or virtually. It is a set of
Okay.
questions. There are
Hmm.
directions, there's a set of questions and posters that they can download. You can place the posters at the nurse's station, hallways, break rooms, and then when you want to gather your team together, you will provide them the printout of the questions and they go looking for the answers on the posters
Oh,
and
okay.
then kind of bring it back together collectively. They can work on it individually or collectively, however, the facility decides, and they can review those infection control principles. So it's something, it's kind of a team building exercise that either a supervisor, a manager, a lead nurse can run just to kind of do it a little bit different than sitting listening to a presentation.
I love that. I love the
Yes.
application-based,
Mm-hmm.
immersive-based learning. I think
Mm-hmm.
we learn better through story or when we're applying concepts. So that's
Right.
great. That's really
Right.
great to offer that.
And I think there was a
You have a few
question.
more.
Someone, yes, someone joined late. Yes, you will be receiving the PowerPoint.
I see you got
Kendall
choose
will
the
be
camera on. Hi.
Kendall will be sending that out, I think, in the next day or two.
Yes, I will. Thanks for your question. Hello with your camera on. It's nice to see you. Wanda said thank you, and then Vixana said thank you so much. The session was
Okay.
educative, and I love to see more of this every month. Well, you are welcome
Okay.
to join us. Thank you for being
Yes.
here. We
Well,
appreciate you.
we have another one next week, and that's on draining wounds. So,
That's
if you're
exciting.
interested in that, please join us.
Yay! This is great feedback. Again, anyone is welcome. We have the time, so you are welcome to ask any and every questions that you have. I want to make sure that I'm allowing everyone to do so because unlike Teams or another
Mhm.
forum, I don't see if you're typing. I don't get the little dot dot dot. So if you are typing, I just want to offer the opportunity to take your time. We're here for questions. Um, shall you have them? Okay. I don't think it seems like if it's okay to begin to conclude that there's not any other questions popped into the chat. But I will say if you think of any, you're more than
Mhm.
welcome to. Oh, here we go. Yvette. Yep.
Oh,
Hi. Are you
Yes.
available for group training?
Yes, we are. And what we can do is, let's see. I don't know if you go to our website, I believe there's a link to request a training. If not, if you want to put your email address in the chat, I will send you our request form and we can do a webinar or we can do an in-person training. And in-person training can be um, any of our 17 topics, and we also have our escape room. So I will, Yvette, yes, I will send you, let's see. Copy that.
I just pasted the website into the chat
Okay,
for those interested.
good, good. And I think I just got,
Great question.
yeah, that's a very good
Two
question.
more. One is a question, one is a feedback. So Vixana is asking another question. Is the training available for individuals only?
Um, Individuals, usually we do not do it for individuals, we do it for groups. But you are welcome, our online learning site. That is more like individually based. You can do those 17 topics at your convenience, anytime, day or night, once you create the login. And if you don't have access to the online site, I did put that in the chat. You can fill out that request form. It's just 2 or 3 questions, and then we'll send you the link and um, you would get access to it. You just need a login, which is your name and an email address. And is it for adults only? Yes, basically it is for adults, healthcare, working in healthcare, frontline healthcare workers and environmental service staff. Did
But that
that
is great
did that
feedback.
answer your question?
For adults only, the training. Mm-hmm. Yes, she said yes.
Yes.
Thank you. I think
Okay.
that's a great,
Good.
I think that that's a great question.
Okay.
Great
Yes.
feedback to
Yes.
put back to
Right.
leadership. Grace had made a comment. She said, "I've done the project Firstline topics and I highly recommend it."
Oh, good. Oh,
Thanks,
thank you,
Grace.
Grace. I
Great.
thought your name looked pretty familiar. Yeah, so please feel free if you want, or if you have, if for some reason you do any type of teaching in any facility and you have healthcare workers that are studying and, they're in any type of schooling program, they are welcome as well to do those topics. Is
We have
there any risk or cost for the train? No, everything is free. All of our Everything provided to us through the CDC for this project is free. The escape room training, we bring all the materials. If we're doing just a basic webinar, there's no cost, there's no fee for anything. We just need to know. I would set up an appointment and we would talk about what type of training and scheduling, but nothing, there's no charge for anything.
which is great. I'm like,
Hmm.
it's a way to bring infection prevention, infection control education in a way that's
Right,
accessible, but
right.
credible because it's coming from the CDC.
CDC,
Um,
right.
we do have another question.
Okay.
Are there any CEUs available for any, I think, of the learnings or teachings through Project?
Right. So yes, there are CEs available. Again, I believe that information is on our website and it's for nurses, advanced practical nurses, and physicians, and I believe physician assistants. We also have CEs for the dental practice as well. So for dentists, dental hygienists, we just had that approved probably about 6 or 8 months ago.
That's great news. And
Hmm.
just to clarify, when someone is accessing the website, will that information, it being this is CEU eligible, be presented on each training so that you're aware of the ones that you are deciding to complete, which ones?
So if you go to the website, it will
Mhm.
have the link to the online learning site, and the online learning site has information about the CEs, and they're in like different courses or catalogs. So
Okay.
that will have all the information. So you could either go to the website to connect to the online learning
Mhm.
once you have a login, or you can go, once you have a login, you can just go right to the online learning and there's information there. And if you need some assistance or you're not sure, just email us at mdfirstline@hqi.solutions, and we would be glad to send you some of our flyers about the CEs.
Sure. Thank you for sharing that. I just have a
Hmm.
follow-up question. From a user perspective, that if,
Hmm.
say, for instance, I completed the training and I was interested in receiving the the CEUs for those, could you then talk our audience through then what can I expect in terms of receiving it? Like once I complete the training, will that come in an email? Is that something I need to contact Project
Right.
Firstline
For the CEs, you have to do groups of topics. Like you
Okay.
wouldn't earn CEs for just one topic.
Okay.
So, say our topic number one is infection control, and
Hmm.
there are four different topics that you have to complete. You have to do the feedback. You have to complete it. It's an entirety, and then you would do those online on our online learning site. And then once you complete that and I think there's like a simple quiz, you pass that, then you're emailed your certificate and it will tell you how many CEs.
That's great. Okay. Yeah, I wanted to
We did,
understand the process.
right. We
Hmm.
did hold a webinar for the dental professionals
Hmm.
so that we clustered the topics together, and then we sent out the link for them to complete the quiz. And once they passed it, I think with 100%, then we received that information, and then the certificate with the number of CEs were sent to them. It's a really low number. Like you have to do maybe two or three courses, even four for like 0.25. But if you do all of them, if you do
Hmm.
all of the topics we have, I think it totals up to about seven CE courses.
Okay, that's great. I appreciate you sharing that. I just
Hmm.
popped the website in the chat again
Okay.
for those who want more immediate access to explore that. If there are not any more questions, again, I want to
All good
leave the room.
questions. Thank you so
They
much.
are, they're so thoughtful.
Hmm.
And I appreciate all the feedback. It's great to know that people have had a great experience um, learning from Project Firstline. But does anyone else, as we prepare to wrap up for the day and give you back the rest of your lunch hour, have any more
Hmm.
questions for us here? Just want to offer the space. Okay, it doesn't look like there is
All
just
right.
now.
Okay.
Um, so with that being said, we're going to prepare to wrap up today. So as we conclude today's webinar, I want to thank our speaker, Diane, for putting together such an informative presentation to help us better prepare for the respiratory season or other seasons with this microlearn training format that Project Firstline offers. We so appreciate the time and care you've put into sharing this information with us today. So thank you so much for being with us. Um, I want to extend my heartfelt gratitude, as always, to each of you in our audience. Your presence and participation make our work meaningful, and we do this for you. So thank you so much for joining us today. If you have any further questions, or need any additional resources, please don't hesitate to reach out to us at the EPN. In a moment, I'm going to pop that information into the chat. But additionally, I can provide you in the chat and in a follow-up communication the contact information for our speaker that she graciously provided us today. And following the presentation, you can look forward to receiving the presentation materials, which will include a PDF copy of today's slides, alongside the recording and some additional supportive resources like the MicroLearn guide just for you. So thank you so much again for joining us. I'm going to pop our contact information here in the chat for you. Um, and I am so grateful to connect with each of you today, and I look forward to seeing you next time. Please, please join us.
Have a great day, everyone.
Thank you, everyone.
Thank you. Have a good day.
Thank you,
You
you
too.
too. Mm-mm. Thank you. Thanks, Grace. Thanks, Vixana. Oh, thank you. Thank you. Thank you. welcome. Bye, everyone.